Post-traumatic stress disorder, PTSD, is brought on by witnessing a terrifying, usually life-threatening, event. Severe anxiety, flashbacks, uncontrollable thoughts, and nightmares are common symptoms of the illness. These symptoms can worsen and last for years, so it is best to seek treatment for PTSD as soon as possible. The Mayo Clinic mentions several recurring symptoms, including fearful thoughts, flashbacks, and bad dreams. These symptoms can become problematic in a person's life. Some of the avoidance symptoms include difficulty remembering the traumatic event and avoiding reminders of the experience, such as places, people, and objects. Hyperarousal symptoms may also arise, such as feeling tense, being startled easily and having trouble sleeping. While it is normal to experience some of these symptoms after a terrible event, symptoms lasting more than a few weeks may be signs of PTSD. Types of events that can lead to PTSD include serious road accidents, violent personal assaults, such as sexual assault, mugging or robbery, a traumatic birth, prolonged sexual abuse, violence, or severe neglect, witnessing violent deaths, military combat, being held hostage, terrorist attacks, natural disasters, such as severe floods, earthquakes or tsunamis, a diagnosis of a life-threatening condition, an unexpected severe injury or death of a close family member or friend. PTSD isn't usually related to situations that are simply upsetting, such as divorce, job loss, or failing exams. PTSD develops in about 1 in 3 people who experience severe trauma. It isn't fully understood why some people develop the condition while others don't. But certain factors appear to make some people more likely to develop PTSD. Survival mechanism. One suggestion is that the symptoms of PTSD are the result of an instinctive mechanism intended to help you survive further traumatic experiences. For example, the flashbacks many people with PTSD experience may force you to think about the event in detail so you are better prepared if it happens again. The feeling of being on edge, hyperarousal, may develop to help you react quickly in another crisis. But while these responses may be intended to help you survive, they're actually very unhelpful in reality because you can't process and move on from the traumatic experience. Studies have shown that people with PTSD have abnormal levels of stress hormones. Normally, when in danger, the body produces stress hormones like adrenaline to trigger a reaction in the body. This reaction, often known as the fight or flight reaction, helps to deaden the senses and dull pain. People with PTSD have been found to continue to produce high amounts of fight or flight hormones even when there's no danger. It's thought this may be responsible for the numbed emotions and hyperarousal experienced by some people with PTSD. In people with PTSD, parts of the brain involved in emotional processing appear different in brain scans. One part of the brain responsible for memory and emotions is known as the hippocampus. In people with PTSD, the hippocampus appears smaller in size. It's thought that changes in this part of the brain may be related to fear and anxiety, memory problems, and flashbacks. The malfunctioning hippocampus may prevent flashbacks and nightmares being properly processed, so the anxiety they generate doesn't reduce over time. Treatment of PTSD results in proper processing of the memories so, over time, the flashbacks and nightmares gradually disappear.